Come on in, Instagram. We got a great topic to share with you here today. I just found out about this paper that came out in a journal all about whether we need to be considering having a lockdown on sugar as a means of dealing with this pandemic. And so come on in. Welcome, welcome. Thanks for being here today. I know I don't normally go live over on the Living Low Carb Man page, but a lot of people have said, hey, we miss seeing you on camera. Can you do some stuff on camera? I'm like, yeah, sure. So I have a paper today I want to read to you, and it's a paper all about what I affectionately refer to as 9-1 DIVOC. So it's the pandemic. If you do 9-1 DIVOC backwards, you know what I'm talking about. Okay. They censor you if you say that out loud, so I always have to speak in that code. So work with me here. But there's a paper here from two people you may know about. One of them you definitely know about. Her name is Nina Teicholz. She wrote a book called The Big Fat Surprise. And then she was joined in this paper by Dr. Mark Cucuzzella. So I've had Mark on the Living La Vida Low Carb show several times. And both of them are committed to sugar being the enemy in our health, and we need to somehow deal with that. And so they're relating it to 9-1 DIVOC, to this pandemic. And so I wanted to come on live, let you guys know about this paper. It literally just came out, hot off the presses, March of 2021 in the journal, Clinical Journal of Sports Medicine. And so this just came out in the last few days. I wanted to come on here. I'm also simulcasting over here on my Keto Clarity Clubhouse page. So hello to you guys as well. Thank you for being here. But I wanted to read this paper because this is the kind of evidence that needs to get out there. Now, we've been talking about having lifestyle and diet be at the forefront of prevention. A lot of us in the keto space and the general health space, we've been trying to get the leaders on high to pay attention to what people are eating, because the irony is all of the things they're having us do are mechanistic things. Cover your mouth so you don't spread and get, stay at home, isolate yourself, all of the things. And not one single one of these things that they're having us do actually does anything to improve your immune health, does anything to improve the comorbidities that are involved in the people having the worst effects from 9-1 DIVOC. This paper is going to address that. So if you just came in, yes, Jimmy is live on video. A lot of people have been saying, hey, we miss seeing you on camera. I'm like, okay, yeah, I can see what I'm just kidding. Yes, I want to come back on camera again. I am simulcasting over on my Keto Clarity Clubhouse, but let's get this show on the road. I got a great paper to read to you. The title of it is it time for a lockdown on sugar? Again, it was written by Dr. Mark Cucuzzella. He is a medical doctor out of West Virginia. And Nina Teicholz, she's the best-selling author of The Big Fat Surprise. So let's read this article, published just a few days ago in the Clinical Journal of Sports Medicine. As we reopen society and we search for medications, as well as the jab in the arm that could improve coronavirus outcomes, we should not miss the opportunity to talk about all the conditions that have increased our vulnerability to this pandemic in the first place. America's poor state of health. Let's stop there. From the very get-go, when this came to the shores of America, I knew this was going to hit America harder than any other country in the whole world. We are literally the sickest, the fattest, the most unwell, the most ubiquitous with junk food. It made every bit of sense in the world that would be the first thing that we would try to address. So imagine my surprise and the surprise of so many in this space that when nothing, and still to this day, over a year later, not one damn word about what you're putting in your mouth. And see, Dr. Cucuzzella and Nina Teicholz, they both know that this is the crux of the problem. And one of the things that I was hoping this pandemic would do would be open the eyes of people that what you're putting in your mouth matters, that You can't just willy-nilly eat food like disease agents, which is what all the junk food, crappy garbage that I call it. You can't just willy-nilly eat those things and expect your body to respond in a positive way. You can't expect your immune system to be as strong as it could be. They're not promoting real food. How hard would it have been for them to say, wear a mask, socially distance, stay at home, and eat real food? Like literally just add in eat real food to that list of things. And then if people started having questions of what's real food, then they could have the education piece of, focus on this and this and this. They didn't do any of that, which is why we're trying to pick up the pieces. And you got editorials in journals coming out now, because this is like a year late. How many lives could have been saved if they had done some of the things that Nina and Dr. Cucuzzella wrote about in this article? All right, let me get back to it. Some 60% of us has one or more diet-related chronic diseases, and the cost of this is a staggering contribution to the $3.5 trillion annual U.S. healthcare expenditure. Think about all of the major chronic diseases of our day. Almost every single one of them is related to diet and is related to the metabolic effects, hormonal effects on our body that increases inflammation, increases insulin and blood sugar, and leads to all the cascade of all the diseases of insulin resistance, which they're going to hit insulin resistance very hard here in a minute. It's so sad to me that the message I've been preaching for well over 15 years, so many of us have been out here. Gary's been writing about it. Gary Taubes has been writing about it since the early 2000s. Nina since about 2011, 2012. Mark's come on the scene. He's been a doctor for over 10 years. Like, we've got a lot of people that have been talking about this for a very long time. Why have they not heeded the call before now? And so now they're trying to get this out there. We've got this huge $3.5 trillion problem. These diseases, talking about all the chronic diseases, have accompanied a large majority of severe cases in the U.S., according to the Centers for Disease Control, with the two most common underlying health conditions. Number one is cardiovascular disease. 32% of the people who get 9-1 DIVOC, cardiovascular disease is their number one comorbidity. It's also the number one killer in America. Annually, we lose about 700,000 people to cardiovascular disease. And then there's diabetes at closely behind at 30%. So between those two conditions, we're talking about 2/3 of the people who get 9-1 DIVOC having the worst symptoms of it. They've got two preventable diet-related diseases that are the cause, that are the underlying condition. And a lot of people have both cardiovascular disease and type 2 diabetes. Hospitalizations were 6 times higher and death 12 times higher amongst those with reported underlying conditions compared with those who had none. So if you don't have heart disease and you don't have diabetes, your likelihood of surviving 9-1 DIVOC is extremely high. So the question becomes, why didn't we warn diabetics? Why didn't we warn people with cardiovascular disease? Why didn't we warn people with obesity? If you cut down on the sugar and you cut down on the refined carbohydrates, you're going to put your body in a much better place. And we know from a lot of the work that I've done over the past 15 plus years, we know that there is a profound change in your metabolic health long before the weight loss starts happening. So had we done that a year ago and told people that we need to lock down sugar and lock down all of the refined carbohydrates that turn to sugar in the body, how much healthier would the population have gotten within like 6 to 8 weeks? And then all those deaths that came in the summer and afterwards might have been prevented had they simply given us the good advice. But they didn't do that. They didn't even come close to doing that. And they still haven't done it. That's the frustrating part. In a large study in the New York City of 5,700 patients hospitalized with 9-1 DIVOC, 57% had hypertension. Hypertension is high blood pressure. 42% were obese, and 34% had type 2 diabetes. Obesity is clearly emerging as a dominant factor, greatly increasing your risk of hospitalization and death. And I would say obesity and all the obesity-related diseases related to insulin resistance. So usually people with obesity manifest also as type 2 diabetes and or cardiovascular disease. In one of the most recent studies on comorbidities to date, it was conducted in France. Only 1 out of every 10 people who ended up in intensive care with 9-1 DIVOC were in a range of healthy weight. So 90% of the people who were in the worst of the worst situation as it relates to having the symptoms of 9-1 DIVOC, 9 out of 10 of them were obese. Only 1 was in the healthy range. Researchers led by Francois Patel, the head of Lille University's Hospital's General and Endocrine Surgery Department in France, presented the data at a conference showing that about half of the 124 intensive care patients with 9-1 DIVOC in a sample, they were obese, and most of the remaining ones were overweight. Thus, to build resilience to this and future viruses, we need to start talking about better nutrition. And again, if you just joined us late, yes, I'm live on Living Low Carb Man. I'm going to try to come back on camera. A lot of people said you miss seeing my face, so here we are. I'm also live over on my Keto Clarity Clubhouse. Hello, guys. Thanks for being here today. And we're reading from a paper. It's an editorial from the Clinical Journal of Sports Medicine. And this came out just last week, within the last few days this came out. It's an editorial from Mark Cucuzzella. It is an MD. He is an MD. And Nina Teicholz, you know her from the Big Fat Surprise, also the Nutrition Coalition, trying to change the guidelines. And they have co-authored this editorial entitled, "Is It Time for a Lockdown on Sugar?" And they're kind of making the case that we've done everything wrong about this pandemic, only focusing on masks and social distancing and stay at home and the jab in the arm. That's all of the things that they've told us to do. And not one single breath has been made in regards to what do we do with our diet. And they're making the case that had we fixed the diet a year ago and all this went down, we could have saved lives and saved a lot of money. Let me get back to the paper. In the United Kingdom, the National Health Service reports that over a quarter of the fatalities from 9-1 DIVOC are accompanied by diabetes. Prime Minister Boris Johnson became convinced that his own obesity contributed to his hospital stay, prompting him to declare on launching a probe into the link between obesity and worse 9-1 DIVOC outcomes. "I have changed my mind on this obesity thing. We need to be a lot more interventionist." Isn't it crazy? It took a political leader getting 9-1 DIVOC and realizing that he was having adverse effects from the foods he was eating was making his body less healthy. Gee, who knew? And yet this is the kind of thing that's going to make change happen. Like when President Trump got 9-1 DIVOC last year, nobody said anything about nutrition. How cool would it have been if they said, you know, Mr. President, if you backed off on some of your like junk food consumption, you could be better and da-da-da. But none of that happened here in America. But in the UK, Boris Johnson is looking into that. Of course, when they change the diet and when they talk about changing your diet and cleaning up your diet, it always defaults to the bad diet advice from the dietary guidelines, for example. So I don't know which is worse, getting people bad diet advice that then it doesn't work and they get frustrated and go back to junk food, or give them advice of just get on real food of any kind, indiscriminate of whatever advice is out there. Early on, experts attributed all the high mortality rates of 9-1 DIVOC to air pollution, smoking, and advanced age. And I would say advanced age was the number one killer early on in this. There were a lot of people that died of 9-1 DIVOC that actually they were within a few weeks, months of dying anyway. And so that is true. Yet over the past few months, the significant risk of metabolic illness has suddenly emerged as the number one factor. This is even more pronounced in our minority populations. Minorities who have higher rates of comorbidities and diet-related illness are being affected at higher rates. And quite frankly, this is not a new problem. We've known about minority populations having higher obesity rates, having higher type 2 diabetes rates, having higher levels of heart disease. All of these things have been known for years. So this isn't something that just crept up all of a sudden and we're like, oh my gosh, we had no idea that they would be the most susceptible. Yeah, we did. Yeah, we did. And I posted this past week about there being a disparity. There was a study that came out that showed there's a great disparity in the treatment of minority populations as it relates to diabetes and how it's impacting their susceptibility to this virus. So go look on my Instagram page if you missed that. I posted it, like I said, just a few days ago. Really fascinating. Like, they need to do more investigation of why we're not educating that population of people about how they can be more healthy. And again, that's an uphill battle because all the dietary advice that they promote is the dietary guidelines, which are predicated on low-fat, high-carb diets, and that may not be the be-all, end-all. Indeed, there was a recent report that found per capita death rates from 9/1 DIVOC have increased dramatically over the summer for Black and brown Americans. Although fatalities also increased for white Americans, the impact on this group has been notably less severe. The latest figures record that in the 2 weeks from August 4th to the 18th, the death rate of African Americans shot up from 80 to 88% or 80 to 88 per 100,000 population, which was an increase of 8 over that time period. By contrast, the white population suffered half that increase, 36 to 40, which was only an increase of 4. For Latino Americans, the increase was even more stark. They went from 46 to 54 per 100,000, which was an increase of 9. The most recent US CDC data reveals almost 5 times the hospitalization rates for Blacks and Latinos versus whites. And yet again, we're pointing out an obvious disconnect here. A lot in the minority populations are saying we're not getting the treatment that we need that would help us properly deal with the disease. Some of it's economic, some of it's cultural with food choices and things like that. But education definitely could help in that area. So now they're getting into insulin resistance. This is the key as to why we need to have a lockdown on sugar. Almost all of these comorbidities, hypertension, diabetes, coronary artery disease, and obesity have one common root cause. It's insulin resistance. It's diagnosed when a person has a whole spectrum of symptoms, including abdominal obesity, high blood pressure, high blood sugar. According to one recent estimate based on government data, no less than 88% of Americans currently have insulin resistance somewhere on that spectrum. Okay? So that means 9 out of 10 people. That means most of you watching or listening to this right now, most of you at least have some level of insulin resistance. Some of you very severe, some of you less severe, most of you somewhere in the middle. Given that chronic diseases are strongly implicated in poor outcomes for this 9/1 DIVOC coronavirus, we need to take insulin resistance far more seriously. The problem is the way we're treating it right now, they don't take it seriously. Most doctors, you talk about insulin resistance and they have no clue what you're talking about. They don't know that it's tied to the junk food that you're eating. They don't know that cutting sugar would be a huge step in the right direction. They don't know that refined carbohydrates are the issue. No, what they do, they focus on fat. Oh, you need to cut the fat because it's highly inflammatory and it's going to cause all these diseases in your body and that raises insulin resistance. No, it doesn't. Real food-based fats like butter and ghee and coconut oil and lard and olive oil and avocado oil in the absence of refined carbohydrates are unbelievably healthy for you. And yet they're not telling people that. They're telling them to eat healthy, quote, healthy, whole grains and to cut your fat and instead replace the bad fats, all those fats I just mentioned, with the good fats, which ends up being canola oil, vegetable oil, all these very refined seed oils, which are highly inflammatory for people. Not doing them any good at all. And, oh yeah, by the way, all of that makes your insulin resistance worse. So they looked at some of the causes of insulin resistance. Insulin resistance has been called a metabolic storm. Think about when 9-1 DIVOC came out. They talked about there being this cytokine storm in the body. When 9-1 DIVOC hit, you create this cytokine storm in the body where your immune system's trying to attack it. Well, guess what? Insulin resistance is this metabolic storm of the same way. When you consume those foods that are less than desirable for you, junk food, fast food, you name it, all the everything that for most of us, it made us fat and sick. All of that creates a hormonal effect that over time, that boosting of the insulin and then having to shuttle the sugar into your cells and then boosting your insulin, and more insulin is needed to shuttle it into the cells. And after a while, the insulin's like, yo, I'm out, bruh. I can't handle this anymore. You're overloading me with too much of this stuff. We didn't need it to begin with, and yet now we're going to pump out more and more and more. And that's why your insulin levels go up and up and up, even though your blood sugar levels may not go down and down and down. It will keep up for a while, but after a while it goes, dude, we can't handle this anymore. And they check out, and insulin just kind of starts floating in the body. This is where you have the trouble. This is where the weight gain comes in. This is where type 2 diabetes develops. It's where heart disease develops. All of it is related to the insulin resistance from all that junk food. The principal malfunction is related to the body's ability to process sugars in the blood. Our bodies are made to withstand sugar. I just came off of an 18-day fast last Thursday. And while I haven't had sugar, I have been watching my blood glucose. I'm wearing a CGM right now on the back of my arm. And so I'm looking at my blood sugar level, and I'm eating more often, kind of on purpose. I want to see what happens if I eat more often and don't fast at all. Just kind of keep food in my body, just to kind of see, is it going to impact? My blood sugars have been so steady, like steady Eddie throughout the day, even though I'm eating more food. It's just fascinating how that little bit of a reset kind of cured some of the insulin resistance, because my cells were like, hey, we love what you did during that fast. Now we're going to reward you by taking care of the food that's in your body. And again, I'm not eating junk. I'm sure if I had a Three Musketeer bar, it would go shoo, but I'm not doing that to myself. So a healthy body reacts to sugar by stimulating the pancreas to secrete insulin, which then shunts the sugar off to be stored in the liver, the muscles, or the fat tissues at some point. This insulin mechanism is then overwhelmed. So your body does all it can to get this sugar out of your system. And I think they note it somewhere in here, but I'll go ahead and make this point now. In your entire blood system, how much sugar do you think you have in your entire body, in your blood? So when you prick your finger and you squirt the blood to get a blood sugar reading, how much sugar is in that entire body worth of blood? Any guess? 1 teaspoon. 1 teaspoon. And I think back to the days I used to drink like 16 cans of Coca-Cola. 1 Coca-Cola is 45 grams of mostly high fructose corn syrup, sugar. You divide that by 4, that's over 11 teaspoons of sugar just in 1 Coke. And in your whole body, you have 1 teaspoon. So when you flood your body with that much extra sugar it doesn't need, it's pumping out insulin like crazy, trying to shuttle all that sugar into your cells. And then by pushing it into your cells, it starts to fill up your fat cells, as they were saying, and then it goes into your glycogen stores first, and then the fat cells. If it's got nowhere else to put it, you're going to start growing body fat, because that insulin just doesn't know where to. It's a fat storing hormone, insulin is. This is why you want to keep the insulin low, because then the fat storing stops and the fat releasing happens. That's what you're trying to accomplish. So an overabundance of sugar in the bloodstream throughout the day, after many months, erodes this body's ability to respond to insulin. And when insulin basically goes, la, 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 don't hear you anymore, that is when you become insulin resistant. Levels of circulating insulin will rise at this point, because keep in mind, it had a modicum of insulin that was trying to deal with the carbs you're eating. And now that you're eating them in high quantities, your body's like, all right, bruh, you keep giving us all this sugar. We've got plenty. We got to bring in more troops. And that's when your body increases its insulin levels. And so elevation in insulin is one of the kind of first big signs of insulin resistance. This ultimately leads to a lot of conditions if the insulin resistance is left unchecked: type 2 diabetes, obesity, non-alcoholic fatty liver disease, and heart disease. And every one of those conditions is tied back to insulin resistance. The primary driver of this excess sugar in the bloodstream is the food that we eat. The reality is that not only do simple sugars such as candy convert to blood sugar, but to do more complex more complex carbohydrates. Things like bread, pasta, crackers, and even sweet fruits. See, this is something that was thrown in my face when I first came online. I had people that said, oh, Jimmy, yes, sugar's bad, but complex carbohydrates are healthy for you. And I'm like, okay, tell me why, if complex carbohydrates are healthy for me, when I eat a non-sweet food like bread, pasta, crackers, why does my blood sugar go up? Nobody could ever answer that. They're like, well, blood sugar going up's no big deal. It goes up, comes back down. That's normal human process. And I'm like, okay, you're right. But 1 hour postprandial, it doesn't need to jump 90 points. 2 hours postprandial, it needs to at least be somewhat back to baseline again if my insulin responded properly. What happens when it doesn't? And more times than not, it doesn't. For people, remember that almost 9 out of 10 have insulin resistance. And if you have insulin resistance, your body's going to struggle to get back to that baseline within 2 hours after having even the complex carbohydrate, even fruit. These all become sugar, and in the body, sugar is known as glucose, as soon as they get digested. I remember Dr. Richard Bernstein. If you don't know who that is, go look him up. He's a very famous diabetic doctor. He actually was not a doctor. He went back to school at the age of 42. He was an engineer. He was the guy that came up with the blood sugar testing device. So he was the one, if you get a glucometer today, you need to thank Dr. Bernstein. He was the one that invented that concept. And it was really big at the time in terms of like the size of the machine. They've now got them very small and very cheap. But he was the one that said, hey, we need to be able to test our blood sugar on our own. He had type 1 diabetes, was frustrated that nobody was listening to him about carbohydrate restriction as a way of dealing with it. So he became a doctor so that he would be taken more seriously. And then he saw patients for many years. I think he's in his 80s now. I'm not sure if he's still practicing. But anyway, he was the one that went on a TV show, and he went up against one of the American Diabetes Association dietitians. Hope Warshaw is her name. And he said, oh, you don't think bread is going to be a problem for my diabetes? And so he got out this little testing stick. He stuck some bread on the roof of his mouth. He pushed his tongue up against it. And then he tested for the presence of sugar. And he pulled the little test out of his mouth. Black, meaning it was the presence of glucose from that non-sweet bread. So he made the point that yes, you can raise your blood sugar even with complex carbohydrates. Thus, to avoid high blood sugar, the logical solution is, cut down on eating them. Easier said than done, of course, but there are now some 100 clinical trials all showing altogether that carbohydrate restriction is safe and effective for basically reversing a diagnosis of type 2 diabetes. It also brings down your blood pressure, improves cardiovascular risk factors, and it helps people to lose weight. So guys, if you're just joining us, I am reading from a brand new paper that just came out a few days ago. It's an editorial published in the Clinical Journal of Sports Medicine just a couple of days ago, 2-3 days ago. It's entitled, Is It Time for a Lockdown on Sugar? We're simulcasting over on my Keto Clarity Clubhouse. Thank you guys for being here today. And we're here on the Living Low Carb Man Instagram page. Thank you guys. I want to get back to the paper. It's by Nina Teicholz, the author of The Big Fat Surprise, and then Dr. Mark Cucuzzella, who is a West Virginia medical doctor, big into the ketogenic diet with his patients. All right, so let's get back to the paper. What are the possible mechanisms for worse 9-1 DIVOC outcomes with metabolic disease? So they're going to go into why do we see these worse outcomes with 9-1 DIVOC when it comes to people that have this insulin resistance and other diseases. Based on all the emerging data, obesity and other chronic diseases may contribute to more acute 9-1 DIVOC outcomes through the following mechanisms. So listen to this. Some of this is going to be a little technical, but I think you're going to be able to handle it. The first mechanism as to why it hits people with the metabolic disease harder is the ACE2 receptor. A virus works by gaining access to the cells of its host and hijacking a receptor on that cell. In the case of 9-1 DIVOC, access is obtained through the ACE2 receptor, which explains why the virus gains access so readily through your lungs and the small intestine. These tissues have ample ACE2 receptors on them. There is some logic to the idea that metabolically ill people, because they tend to have higher ACE2 expression, are therefore more vulnerable to the virus. So I talked about this pathway last year on my show, Jimmy Rants. And yes, I mean, that's a huge theory as to why there are worse outcomes for people that get this virus that have metabolic disease. The second one, endocrine and metabolic link. A recent paper in Nature discusses how the coronavirus may exacerbate or even cause diabetes by seriously damaging the pancreas. Specifically, it attacks pancreatic islets where insulin is formed. People with diabetes are at a heightened risk for the virus because these impaired pancreatic cells combined with 9-1 DIVOC-induced pneumonia may in fact form a vicious circle, amplifying the negative effects that come with the virus. More recently, we've been witnessing unusual cases of clotting and strokes. A 2006 paper in Diabetes suggests that people who are more insulin resistant are less likely to have clots dissolve and are especially susceptible to thrombotic events by a concurrent insulin-driven impairment of fibrinolysis and a glucose-driven activation of coagulation. I know that's a little bit medicalese, but I think you get the point of it messes with all of the pathways that would make you healthy and improve your immune system, and yet this insulin resistance just kind of throws a monkey wrench in all that. Another theory is immune dysregulation. People with insulin resistance are likely also vulnerable to the virus because, by very definition, you've weakened your immune system. The immune system exists in two parts. There's the innate, the first responder, and a more delayed, the adaptive, the second responder, which provides additional immunity. Both of these arms combine to reflect your overall health. Both of these immune systems are negatively impacted when you are obese and you have metabolic syndrome. In 2017, a biologist named Catherine Anderson explored this topic. In 2019, researchers added to the discourse in the journal Nature, stating that during respiratory viral infections, insulin-resistant participants respond differently than insulin-sensitive participants. Global co-association analyses amongst the thousands of profiled molecules reveal that specific host microbe interactions that differ between insulin-resistant and insulin-sensitive individuals. Importantly, this article noted and explained how the more delayed and robust cytokine release in those with insulin resistance may contribute to why they have a worse cytokine storm than someone who's insulin sensitive. Moreover, visceral adipose tissue itself can also contribute to the cytokine storm. So this is why they're pointing to, if you have obesity, if you can lose the visceral fat, you're going to be a lot better off if and when this virus hits you. High blood sugar is the next topic in the article. Persistently high blood sugar clearly hinders immune response. According to a 1972 paper, it states hyperglycemia, which is high blood sugar, negatively affects white blood cell defense against infection. High glucose impairs these cells in the innate immune response to invading organisms. More recently, high blood sugar was found in an analysis of more than 7,000 Chinese 9-1 DIVOC patients to be the single most important determinant outcome for hospitalized patients. Did you get that? High blood sugar. Now, how hard is it for us to test our blood sugar and do the things to bring blood sugar down? Blood sugar devices, I can go down and get a glucometer at any drugstore, at Walmart, wherever you buy stuff, medical stuff. Everybody has a glucometer. If you don't have one, go get one, because it's going to be the indicator of your state of health and how you're going to do if and when the time comes you get this virus. All right, researchers found that mainly because of high blood sugar, subjects with type 2 diabetes required more medical intervention and had a significantly higher mortality rate and multiple organ injury compared with those who were non-diabetic. So are you getting the moral of this story here? You got obesity, you got high blood sugars, you've got type 2 diabetes. All of those things are these main risk factors. And if you have all those things, you have a propensity for cardiovascular disease. All of these are the reasons why people get bad outcomes with 9-1 DIVOC. So the moral of this story is don't be obese, don't have type 2 diabetes, don't have high blood sugars, and don't have heart disease. You do that, you're going to prevent this thing. Why aren't they telling us this? Why does it take an op-ed from a science writer and a medical doctor who gives a damn about their patients? This is the kind of thing that gets me upset, because how easy would it be for them to just throw in a tag on the end of wear a mask, socially distance, stay at home, get the jab in the arm, and eat real food? How hard would that be for them to do? Not hard at all, but they don't do it. So we're at the end of the article. For safer re-entry, eat real food and limit your sugar. Recently, the World Health Organization launched a Stay Healthy at Home campaign. They urged adults to limit their sugar consumption to less than 6 teaspoons a day. Remember, how many teaspoons is in your entire body in terms of your blood system? 1. And they're saying 6. Let's just flood their bodies with 6 times the amount of sugar that their body needs. 6 teaspoons of sugar is the amount of sugar in 1 small carton of chocolate milk that they serve at school. The reality is we are partially responsible for our own fragility to this virus. Now we're hoping for a jab in the arm and other medications to pull us out of this pandemic, but the current crisis reveals how vulnerable we are. We have often blamed the victim for having obesity. Anybody been to a doctor? Hey, you need to cut down on your fat, fatty. I've had doctors say that to me. Or other diet-related diseases, but these illnesses now affect up to 80% of the world's population. Our current 9-1 DIVOC approach has focused on hiding from the virus. That's always been a stupid approach, in my opinion. You don't hide from a virus. All of us are going to get this virus. Get it over with, have herd immunity, and move on with our lives. Why have we been running away? Keep the most susceptible safe, all those people we talked about earlier. But most of us could have been out there living our lives. And we're now hoping immunization with the jab in the arm is going to set us free. We believe the best idea going forward instead, though, is for us to strengthen our resilience to 9-1 DIVOC and future viruses with a healthy immune system, which starts with living a healthy lifestyle. How do you do that? Reduce sugar, reduce refined carbohydrates. These two together fuel your insulin resistance more than anything else. It's the ideal first step. Eating to keep your blood sugar low and stable will clearly reduce your risk. Anyone can purchase a CGM, which again, I'm wearing one as we speak. Just this thing right here. It's $70. You can ask your doctor to get you the sensor. I use my phone to do the little readings, and you can see on a whim exactly how your blood sugar level is doing. Junk food is the obvious enemy, even if it can be every quarantiner's best friend. That was the disappointing part. Right after we went on quarantine last March, all these people went to Costco and Sam's Club and all the big box stores and bought all these massive amounts of junk food. I remember doing a Jimmy Rants all about how junk food company sales went through the roof because people just wanted comfort food. And then they wondered, gee, how did I gain the COVID-19? How did I gain that many pounds? Well, gee, I wonder. You're eating the very thing that makes insulin resistance worse. Yet even these comforting foods can be resisted when you replace them with whole natural foods as well as filling fats and proteins. It is critical to focus the diet on foods that are nutrient dense. So listen to what Dr. Mark Cucuzzella and Nina Teicholz says. If you're going to eat food in the midst of all this to improve your immune system and improve your metabolic health, these are the foods: meats, eggs, seafood, dairy, vegetables, and low sugar fruits. How hard would it have been to give people that? The problem is they've been telling us cut our fat. They've been telling us eat healthy whole grains. They've been telling us all the wrong diet advice for so long. How much egg on their face, all pun intended, would they have if they suddenly said you need to be eating those foods because they're going to be the least problematic for your insulin resistance? They couldn't have done it. And so they didn't. That's why they've been quiet. That's why they haven't said a word. Many people who aim to achieve good health aim to do so through natural means, such as better nutrition or other lifestyle changes. So instead of managing their conditions with a pill, they want to reverse chronic disease with more natural approaches. Our strategy, along with having the jab in the arm, should provide protection now and for many years to come. And that is essential since 9-1 DIVOC will not be like a blizzard hitting hard and quickly passing, but rather a long, hard winter. We all can get healthier right now, and this applies especially to those who currently have some kind of metabolic illness. Each of the comorbidities you have decreases your physiological reserve. We should be doing a better job in maintaining our health for times when we're under stress. This is true, because the last year has been incredibly stressful on most people, on top of people eating for comfort and having those less than ideal food choices. We hope to see a new world where people have the tools to recover their good health and become stronger to fight pandemics such as this one. We're probably in mile number 4 of the 26-mile 9-1 DIVOC marathon. And even as the coronavirus abates, the ongoing obesity, diabetes, and metabolic disease pandemics will continue to take their toll in our society. It is time to take back our health, our own resilience, and that of our nation. Again, you guys, I just read from an editorial published a couple of days ago in the March 2021 issue of the Clinical Journal of Sports Medicine. The title of it, Is It Time for a Lockdown on Sugar? Dr. Mark Cucuzzella, he is a keto, low-carb doctor in West Virginia. He was the one that got his entire hospital to remove all sugar from where they sell food. He's the one that got them to remove sugar out of the hospital. It was the first sugar-free hospital in America. And Nina Teicholz, the Big Fat Surprise, as well as the Nutrition Coalition, trying to change the dietary guidelines. So what do you think about this? I see a lot of comments came in over here on Instagram. I'm also over here on the Keto Clarity Clubhouse. Any of you want to give your comments about this, go ahead and raise your hand. We'll pop you up on stage and let you talk. Looks like my pharmacist friend Brian wants to come up on stage. Brian, what you got for us, bro? Are you on? Go.
Yes, hi.
You're up.
Oh, sorry about that. It was a little bit of a disconnect there on the audio. You know, great article. Mark Cucuzzella and Nina Teicholz. I mean, talk about best of the best. Great article that you had mentioned today. You know, on the same topic, I wanted to say that I was extremely disappointed with Krispy Kreme. I'm sure you've seen this. And I'm not sure if you had mentioned this earlier in your discussion.
It's on my stories. I put them on my Instagram stories today, yes.
Yeah, absolutely. I mean, this is something that history is not going to look kindly upon.
So for those that don't know, Brian, let me tell everybody, because they may be
Sure.
watching going, what are you talking about, Krispy Kreme? So if you don't know, Krispy Kreme currently has this promotion of if you show you have gotten the jab in the arm for 9-1 DIVOC, they will give you a free donut a day indefinitely, definitely for the rest of this year, but maybe going into next year. And it's like the disconnect between what Nina and Dr. Cucuzzella were talking about. It's totally on full display here. They're not understanding that a highly refined junk food, refined vegetable oils and sugar and grains just in a donut. And nobody eats just one donut, Brian. That's the problem too. They get the free donut and they're like, okay, well, I'll get 2 or 3 more while I'm here. So it's a disaster.
It is, and I remember back in the day, there was an advertisement for Camel cigarettes where 4 out of 5 doctors recommend Camel cigarettes. I can see this promotion being on the same level
Yes.
as the Camel cigarettes.
Yes.
An absolute utter disgrace, and it's like I said, history is not going to be kind. I just wanted to throw that out there because when I saw that, I and by the way, people on my team have are like, oh hey, get a free donut, not understanding what the real the reason for why we're here, the reason why we're in this mess. So I just wanted to point that out. So thank you.
You know what might get a lot of keto and carnivore people to buy into the jab in the arm? We'll give you a free dozen donuts or a free box of steaks a week if you go get But still,
Exactly.
no way, Jose, for me still. And that's a pharmacist talking, you guys. So did you like the idea where they were saying people seem to be wanting a more natural way and less pharmacology? I know that's kind of your heart as well. Being a pharmacist, you want people to not have to take those drugs unless it's just absolutely medically necessary.
That's exactly right. I mean, food is thy medicine. I mean, it's coming down to this. And I think that as we continue on with this, we're realizing this is what's happening. We can fix these metabolic conditions with the diet.
Yes.
This is something so simple, no side effects. You're not going to be spending money on prescriptions. You're going to be spending money on food. I'd much rather have you spend money on food than on prescriptions. And I cannot stress that enough. As a pharmacist, that's how I want we all to think now. This is what we should have been done. Unfortunately, we got problems with the pharmaceutical industry. That's a topic for another day. But you get it.
So let's see, insulin or ribeyes? I think I'll choose ribeyes.
Yeah, I think so too. I'm all for the ribeye. Absolutely.
Yes. Well, Brian, thank you for your comments over on Clubhouse, and anybody else on Clubhouse that wants to pop up and make a comment about this new paper. But let's scroll back to the top here on Instagram. I know it's been a while since I've been on the Living Low Carb Man page. I promised to come on camera. A lot of my followers have been like, we haven't seen you on camera in a while except your podcast. Can you come on and do studies? And so I got them. I got another one about fasting coming up soon too. Really fascinating one. But today we focused on this one. So let's see what you guys have to say about this one. Hello. Good to see you as well, Sharon. Thank you for being here. Hello from Norway. Wow, thanks for being here, Liv. Everybody's just saying hi. Okay, how much weight did you lose during your fast? I lost 32 pounds on my 18-day fast. Sports nutritionist out of India. Well, hello. Thanks for being here. I love what you're saying. Thank you. Tanya says, I stopped eating artificial sweeteners and added sugars years ago. Yeah, and thank you for bringing that up. I think, yes, the direct things like sugar and refined carbohydrates are impacting, but I think you make a good point. Even these artificial sweeteners are having some insulinogenic effect in a lot of people, and yet they kind of are looked at as a freebie within the space of health, and they're not a total freebie. They're going to have an impact for some people. I think we have sweet receptors in our tongue and other parts of our body that fools our brain into thinking we're getting sugar, and it actually squirts out insulin expecting to have to metabolize sugar. And then it's like, oh, wait a minute, psych, that's not sugar, that's just something sweet. So you're right. I think some of the artificial sweeteners can be problematic. Thank you for that. Trudeau Nelson said the same thing, Brian. She was saying they're now telling people to go get the shot and they'll get a free donut. Yeah, and it's a free donut every single day. You know, it's not like it's one single donut. You show the V-word card and you get one donut. No, you get a donut every single day for an indefinite amount of time. It's crazy. Cariana says, uniquely suited to make use of our metabolic weakness as a society seems likely. Yeah. And depending on what your theory is as to how this thing got out there, it could be that the people that might have made this in a lab, I'm not saying that's what happened, but if it did, they would know that it would hit America hard. And it has. It has. Claire says, my husband just had a heart attack. I'm constantly trying to explain to people about all the hidden sugars. Don't get me started on hospital food. I'm in the UK. Oh, it's bad, Claire, in America as well. Hospital food is a literal hellhole. In fact, a lot of the hospital food is based on the dietary guidelines for Americans. And in your country, the NHS, I think, puts it out in the UK. And it's no bueno. But guys, if you came in late, I read from an article, go look this up. Is it time for a lockdown on sugar? It's an op-ed editorial piece that was published in the Clinical Journal of Sports Medicine in the March 2021 issue. Just came out a few days ago. Dr. Mark Cucuzzella out of West Virginia and Nina Teicholz, who wrote the New York Times bestselling book, The Big Fat Surprise, all about the connection between our state of metabolic health and outcomes with 9-1 DIVOC. So hopefully they get the message. We've been trying to preach it for a little while here, but they've just turned a blind eye to it. So we're going to keep highlighting these things as we see them. And yes, those of you here on the Living Low Carb Man Instagram page, I will be going live here more often. Had a lot of people reaching out saying you miss seeing me on camera. So I love being on the camera and talking to you. I do all my podcasts during the week. So One Step Deeper and Living La Vida Low Carb show and Real Talk. But I can do some of these now and again. When I see a study that's kind of interesting or something of interest, I'll just pop one here. We also simulcast over here on my Keto Clarity Clubhouse page. So thank you all for tuning in today. We're going to sign off here now on Instagram. We'll see you guys again soon. Bye.